Welcome to This Explainer. Look, if you've been on social media lately, or honestly just chatting with friends, you've definitely heard the massive buzz around these new weight loss injections like Ozempic. But with all that noise, how do we figure out what's actual medical science and what's just, well, internet chatter? Today, we're cutting through the hype to give you the clinical reality of modern weight loss medications. We're going to break down exactly what the medical guidelines say so you can understand what's really going on.
So let's just ask the big question right up front. Do these weight loss drugs really work? Across our communities right here in Africa and really all over the world, we're seeing changing lifestyles and rising health challenges. And because of that, there's been an absolute explosion of interest in these treatments. I mean, we've all seen the dramatic before and after photos, right? And we've all heard the whispered promises of a quick fix. But today, we are separating that viral social media hype from clinical medical reality. We want to empower you with facts so you can make informed decisions about your health, truly understanding what these medications are, and maybe even more importantly, what they aren't.
Section 1. The science. How do these drugs actually work?
Okay, let's dive right into this. To get past the rumors, we gotta look under the hood to see what these medications actually do inside your body. You've probably heard the term GLP-1 thrown around a lot. That stands for glucagon-like peptide 1. Now, in heavy medical jargon, these drugs are based on incretin peptides. But to put it simply, GLP-1 is naturally a hunger-signaling messenger in your own body. It's basically a hormone that acts like a text message between your gut and your brain, regulating your appetite and telling you, hey, we're full. The medications we're talking about, like semaglutide and tirzepatide, are designed to perfectly mimic or boost these exact natural messengers. And the way they work is actually pretty brilliant. It's a dual-action approach. First, they physically slow down stomach emptying. Literally, your food just stays in your stomach longer, physically keeping you full. Second, and this is the really wild part, they work neurologically. They target the brain's hypothalamus, which is like your body's appetite control center, and send super strong signals that you are totally satisfied. So they're reducing your urge to eat from two totally different angles, physically down in the gut and neurologically up in the brain.
Moving on to Section 2, the candidates. Who are these drugs really for?
Now, it's absolutely crucial to understand that these are not casual, superficial, quick fixes just to drop a few kilos before a holiday. Not at all. The clinical guidelines lay out very strict criteria. These tools are meant for folks who haven't met their weight loss goals through comprehensive lifestyle changes alone and who meet specific medical thresholds. We're generally talking about a body mass index, or BMI, of 30 or higher, or a BMI between 27 and 29.9 if the person also has a weight-related condition like hypertension or type 2 diabetes. Doctors also consider them for people with central adiposity, that's excess weight around the midsection, coupled with other health risks. The bottom line here is that these are serious medical tools for managing complex health conditions.
And, this brings us to a really fundamental shift in how we need to look at weight. For way too long, society has treated excess weight as just a lack of willpower, right? But modern medical science tells us unequivocally that obesity is a complex, chronic medical condition. It is a disease that requires compassionate, holistic treatment, exactly like diabetes or heart disease. Treating it means we have to address hormones, metabolism, and deeply ingrained physiological pathways that actively fight against weight loss.
Which brings us to Section 3, the data. Let's look at the reality of the results.
So if someone actually fits the criteria and takes the medication under a doctor's supervision, what does realistic weight loss actually look like? Well, this chart brilliantly illustrates the undeniable clinical power of these modern drugs. In clinical trials running over a year to a year and a half, folks taking a placebo lost about 3% of their body weight. But look at the actual medications. Patients on semaglutide lost an average of around 15%, and those on tirzepatide, which actually targets 2 receptors instead of just 1, lost roughly 22% of their body weight. Guys, those are unprecedented numbers in obesity pharmacotherapy. We're talking about truly life-changing medical outcomes for a lot of people.
But wait, here is the critical catch, and it's something you almost never hear in those viral online conversations. The clinical guidelines are incredibly clear on this. These drugs only yield these phenomenal results when they are actively combined with healthy eating, regular physical activity, and behavioral modifications. Drug therapy, all on its own, without those foundational lifestyle shifts, is generally ineffective in the long run. You absolutely have to put in the hard work alongside the medication.
All right, let's get into Section 4, the reality check. We need to talk about side effects, risks, and costs. It's time we transition to the realities and the limitations of these medications because while they are powerful, they definitely aren't magic.
First up, side effects. Because these drugs fundamentally alter how your gut digests food, gastrointestinal issues are super common. We are talking nausea, vomiting, diarrhea, and constipation. In fact, clinical data shows that up to 40% of patients experience these issues, especially early on when the dose is being slowly increased. Now, they often get better with time and changes to your diet, but they can be really unpleasant. Now, what's really interesting and honestly a bit alarming about this number is a lesser known but highly critical risk. A massive systematic review of 36 different studies found that almost 35% of the weight you lose on GLP-1 medications can actually be crucial muscle mass, not just fat. 35%. Losing that much muscle can seriously impact your physical strength and really tank your metabolism. And this is exactly why medical professionals passionately emphasize that if you're on these drugs, you absolutely must get adequate protein intake and do regular resistance training.
And of course, we have to directly address the elephant in the room: cost and access. For so many people across Africa and really globally, these drugs remain painfully out of reach. Right now, there are no generic options, the out-of-pocket costs are exceptionally high, and on top of that, global medication shortages are a frequent reality. The World Health Organization has actually raised urgent concerns about this. They're emphasizing a critical need for equitable access frameworks so that these life-changing treatments aren't just a luxury reserved for the wealthy. Moving to our final part, Section 5, the long-term view. Remember, these are tools, not magic cures. When we take a step back and look at the long term, we have to understand these are medical tools. The biological reality is pretty stark. Clinical trials clearly show us that if you stop taking the medication, the weight comes back. Studies actually show a projected return to your baseline weight within about 2 years after stopping. Why does this happen? Well, because obesity is a chronic condition. Once you remove that artificial suppression from the drug, your body's metabolism and those hormonal hunger cues actively favor regaining the weight. So the crucial point here is summed up perfectly by the World Health Organization. They advise that GLP-1-based therapies should be used long-term and in combination with intensive behavioral therapy to maximize and sustain those weight loss benefits. Starting these drugs usually means you're making a lifelong commitment to managing a chronic disease. Honestly, it's a lot like taking daily blood pressure medication. Ultimately, the big takeaway here is that weight loss drugs are incredibly powerful, deeply effective medical tools. But their true value isn't about helping someone look a certain way for a photo. Their real value lies in improving physical function, drastically lowering the risk of heart disease, preventing the onset of type 2 diabetes, and helping people manage a highly complex chronic disease. As we wrap up this explainer, I want to leave you with something to chew on. If we truly embrace the medical science, the fact that obesity is a chronic medical condition that requires care, compassion, and sometimes lifelong medication, how does that change the way we view weight loss in our own communities? How does it change the way we judge others, or even how we judge ourselves? I think it's time we move past the hype, embrace the clinical reality, and really focus on true holistic health. Thanks so much for learning with us today.